Hello friends, welcome in my YouTube channel Alive with Dr. Adish Bhargav. Today our topic of discussion is panic attack, anxiety as linked with certain vitamins and mineral deficiencies. Panic and anxiety are common emotions that we all can experience occasionally. When anxiety becomes chronic and panic turns into a full blown attacks, this become a major health problem. It is well known that vitamins and mineral deficiencies can lead to various health problems. But did you know that they can also be linked to anxiety and panic disorders? So in this episode, we can discuss certain vitamins and minerals associated with panic attacks and anxiety. Low serum vitamin B12 and iron could contribute to anxiety and panic disorders. According to a study done in 2013 in Japan by Okayama University, low serum concentration of vitamin B6 and iron are related to panic attacks and anxiety. While the study is very old, but it is still relevant. The researcher looked at a data from just 21 patients whom they have been admitted to the hospital. 10 were patients of anxiety along with panic attacks and 11 with have hyperventilation attacks. When they looked at the patient's blood work, they found that their level of vitamin B6 and iron were significantly lower than the control groups. The control groups are considered to be the healthy individuals. Then again, why does vitamin B6 and iron affect anxiety and panic disorders? The researchers believe that this is because of the serotonin's role in anxiety disorders. Serotonin is synthesized from the tryptophan. During the synthesis of the tryptophan, this synthesis of the serotonin in the brain, vitamin B6 plays the role of coenzyme for tryptophans. Iron is a cofactor for aromatic L-amino acid decarboxylase that participates in the production of the serotonin. If either of these is low, but especially if both of them are low, your body will ultimately have trouble producing serotonins. It is important to note that the researcher did not examine whether or not anxiety and panic disorders are caused by the low serotonin levels. They simply found a link between the two. A lot of research need to be done by the scientists prior they can say with certainty that what causes these mental health disorders. Now, how to support natural serotonin production? Of course, if you have low vitamin B6 and or iron levels, the first thing you want to increase those. The course of action here, unless you are extremely deficient, is to correct using diet. This means specifically increase your intake of food that contains that vitamins and or minerals in adequate amount. Foods high in vitamin B6 they includes fish, includes beef liver, organ meat, potatoes, starchy vegetables, non-citrus fruits, fortified cereals. No foods that are rich in iron, that they includes red meat, includes organ meat such as liver, poultry, fish or shellfish, eggs, nuts, dry fruits, whole grain bread and pastas, fortified breads and cereals, beans and legumes, dark leafy green vegetables, oats and tofu. If absorption is problem, then or you have iron deficiency anemia, then your doctor will likely suggest some supplements. This is especially if you are a vegan or a vegetarian. Levels of vitamin B6 are highest in the meat products, and the type of iron available uh, in vegetarian food sources is often harder for the body to absorb. In these cases, supplements will be needed, likely needed. Other natural way to boost serotonin, if you are experiencing severe anxiety and panic attacks, you should talk to your doctor first as soon as possible. Supplements, diet change, and natural remedies all can help, but they should not be take place the take the place of natural this, medical intervention when it is necessary. You got my point ki whenever we can adopt supplement changes, diet change, natural remedies, but they cannot be a supplement that they can substitute for the medical intervention when it is necessary. Using natural remedies and strategies along with your doctor plan can help you to better manage your anxiety and panic disorder. Besides just vitamin B6, the other B complex vitamin B can also be beneficial for managing the anxiety. This includes vitamin B12, most important, and vitamin B9, also known as folic acid. Another natural remedy is the plant Griffonia simplicifolia. This plant contains 5-HTP, which is a precursor to the serotonin. It is available in supplement form. However, you should consult your healthcare provider or doctor prior to take these supplements. Too much 5-HTP can have negative consequences. This is especially important if you are already in any other depression medication. You got me right? Anti-depression medication if you are taking, and don't take these supplements without the intervention of your health provider and or doctor. Yoga and meditations are other effective ways to help calm the body and mind. These, along with breathing techniques, can help you to manage anxiety and panic when it does rise. Regular yoga and meditation practices can also help to decrease the frequency of the panic and anxiety episodes. So, finally, the bottom line. This study did find a potential link between vitamin B6 and iron levels with the anxiety and panic attacks. This was a small study, however, and does not give us any definitive causation. Just because you have low level of either one of these nutrients does not mean that you have anxiety and panic disorder, and vice versa. Just that you have anxiety and panic attacks does not mean you are low in vitamin B6 and iron. This being said, this is not the first time that nutrition status has to be linked to the mental health. We know that by eating a healthy, balanced diet, we can prevent many conditions and illness, including anxiety. As always, follow your doctor's instructions. Do not stop taking medication in favor of natural solutions, and do not start taking supplements without first checking with your doctor. This is being a medical practitioner. My request to all: prior to take any supplementations or medicine, you should at least consult your primary health service provider, with maybe a doctor, maybe a pharmacist, maybe some nutritionist. Just go for that. So that's all for today. I wish you all healthy, happy life ahead, and probably we have to mend with the techniques or dietary supplements which can relieve us the day-to-day stress that can lead to the anxiety and panic disorders. Thanks for today. Kindly subscribe the channel and share the channel more and more with your circle. If you have any queries, any questions, any thing you want to know, kindly put in the comment box. I will answer it in my better way, in proper with proper knowledge as per I have. I will try to relieve your queries as early as possible. Kindly keep supporting us and stay healthy, stay happy. Jai Hind, Jai Bharat.